The IV pump beeped 3 times, then stopped. Dr. Elena Vasquez looked up from the ventilator settings, her hands still adjusting the oxygen flow. Around her, the ICU night shift moved with practiced efficiency, but their movements had slowed. The kind of slow that comes when everyone knows what's next. Across the room, near the supply closet, David Cole pushed his cleaning cart a few feet to the left. He'd mopped this same section of floor twice already in the past hour. No one noticed. No one ever did. But David was watching the monitor above bed 7 with an expression that didn't belong on a janitor's face. Not confusion, not concern, recognition. If you've ever been invisible in a room where decisions were being made without you, stay with me. David Cole was 63 years old. He'd worked the night shift at Presbyterian Memorial for 9 years, 11 p.m. to 7 a.m. Every night, the same route. Start on the 5th floor ICU. Work down to the ER, end in the surgical wing. In between, he was a shadow, quiet, efficient, forgettable. The nurses knew his first name. The doctors didn't know he existed, and that was exactly how David preferred it. Because 9 years ago, he'd walked away from a different life. A life where people knew his name, where his decisions mattered, where one mistake could destroy everything. And it had. Before David held a mop, he'd held a research position, Dr. Cole, molecular biology. 15 years at a pharmaceutical research lab outside Baltimore. His specialty was protein synthesis, drug interactions, cellular pathways most people couldn't pronounce. He wasn't a clinician. He never treated patients directly. But his work informed treatment protocols. His findings shaped how doctors understood drug metabolism, contraindications, toxic thresholds. He was good at it, meticulous, careful, until the day he wasn't. The study had been routine. A new anticoagulant, promising results in early trials. David's team was validating dosage parameters, identifying potential interactions with common medications, standard work. Except David missed something. A specific interaction with a class of antidepressants. Rare. Easy to overlook in the data, but not impossible to catch. The drug went to phase 3 trials. A patient in the study, a 42-year-old woman with a clotting disorder, was also taking an SSRI her primary care doctor had prescribed months earlier. No one flagged it. The interaction caused a hemorrhagic stroke. She survived, barely, with permanent neurological damage. David reported the oversight immediately, full transparency. The research protocols were updated. The trial was paused. No criminal charges, no lawsuit, just a quiet resignation, and a knowledge that his work, his careful, invisible work, had failed when it mattered most. He couldn't go back. Not to research, not to a lab. Not to a place where his judgment determined outcomes he'd never see. So he found work that was simple, visible, where mistakes meant a streak on a window, not a life altered forever. And for 9 years, he cleaned floors and told himself it was enough. On this particular night, the ICU was unusually quiet. Only 4 occupied beds, 2 post-surgical, 1 sepsis, and bed 7, Jackson Reyes, 29 years old, admitted 6 hours ago with what the ER had initially diagnosed as acute pancreatitis, severe abdominal pain, elevated enzyme levels, textbook presentation. Except he wasn't getting better. His blood pressure kept dropping, his lactate levels were rising, and despite aggressive fluid resuscitation and pain management, he was deteriorating. Dr. Vasquez had been reviewing his chart for the past 20 minutes. Her resident, Dr. Patel, stood beside her. The attending surgeon, Dr. Okafor, had just arrived. "This is what we know," Vasquez said, her voice steady but strained. 29-year-old male, no significant medical history, presented with acute abdominal pain, nausea, vomiting. Lipase elevated. CT showed pancreatic inflammation. We started standard protocol, fluids, NPO, pain control. But he's not responding. BP is 85/50 despite 2 liters. Lactate is 4.2 and climbing. Patel pulled up the latest labs on the tablet. Hemoglobin's dropped 2 points in the last hour. We're not seeing obvious bleeding on imaging, but something's going on. Dr. Okafor studied the monitor. Has he been on any medications recently? Not according to intake, Vasquez said. He told the ER he doesn't take anything. Healthy, active, works in construction. No supplements, no over-the-counter, nothing. Okafor frowned. Young, healthy male with hemorrhagic pancreatitis progressing this fast. It's unusual. He looked at the patient, then back at the team. We need to consider exploratory surgery. If there's internal bleeding we're missing, we're running out of time. Patel hesitated. The imaging was clean. If we open him up and find nothing, we've just added surgical trauma to an already compromised patient. And if we don't, Okafor said quietly, he might not make it through the night. I'm calling the OR. David, standing near the doorway with his mop bucket, felt his chest tighten. He'd heard every word. He shouldn't have been listening. It wasn't his place. But he'd been cleaning this ICU for 9 years. He'd learned to read monitors, recognize patterns, understand the medical shorthand doctors used when they thought no one else was paying attention. And something about this case felt wrong. Not the doctors. They were doing everything right, following protocol, making logical decisions under pressure. But the presentation, the progression, the specific combination of symptoms, it reminded him of something. A case study he'd reviewed years ago, a research paper on drug-induced pancreatitis, rare, often misdiagnosed, caused by a specific class of medications that wouldn't show up in standard toxicology screens. Medications patients didn't always think to mention because they seemed harmless. David set down his mop. He should walk away. Go to the next floor, finish his shift. This wasn't his world anymore. He'd given up the right to have opinions on medical cases when he'd resigned 9 years ago. But the patient was 29, the same age as David's son. And if David was right, surgery wouldn't help. It might make things worse. He took 3 steps toward the nursing station, then stopped. His hands were shaking. What would he even say? That he used to work in research? That he thought he recognized a pattern? They'd ask for his credentials, his background. And then they'd want to know why a molecular biologist was mopping floors. And he'd have to explain. The oversight, the stroke, the resignation, the shame. He turned back toward his cart, but Dr. Okafor's voice stopped him. Prep him for the OR. We go in 30 minutes. 30 minutes. David looked at the patient, at the monitor, at the numbers that kept climbing in the wrong direction. He thought about the woman from Baltimore, the one he'd never met, the one whose name he'd memorized from the incident report, the one whose life had changed because he'd been too careful about his own reputation to ask a question that felt stupid. He'd spent 9 years being invisible, choosing silence, choosing safety. Maybe it was time to choose differently. Excuse me. The words came out quieter than he'd intended. No one turned. He cleared his throat. Excuse me, doctors. This time, Dr. Vasquez looked up. Her expression shifted from focus to mild irritation. Not now, she said. We're in the middle of something. I know, David said. I'm sorry, but I think you should check something before surgery. Dr. Okafor turned. His face was patient but firm. We appreciate your concern, but we need you to step back. Has he been taking any herbal supplements? David asked. The words tumbled out fast. Or workout supplements, protein powders, pre-workout drinks. Anything like that? The room went quiet. Dr. Patel frowned. We asked about medications. He said no. Supplements aren't medications, David said. A lot of people don't think to mention them, especially younger patients who work out. Dr. Vasquez crossed her arms. And you're bringing this up because? Because some bodybuilding supplements contain high doses of L-asparaginase or other enzymes that can trigger acute hemorrhagic pancreatitis, David said. It presents exactly like this. Elevated lipase, rapid progression, internal bleeding without obvious source. And it won't show up on standard drug screens. The doctors stared at him. Dr. Okafor spoke first. How do you know that? I used to work in pharmaceutical research, David said. Molecular biology, drug interactions. I studied cases like this. Vasquez's expression shifted. You're a janitor. I am now, David said. But I wasn't always. Patel looked at Okafor. Is that even possible? The supplement thing. Okafor didn't answer immediately. He was studying David's face. Then he turned to Vasquez. Ask him, directly, about supplements, workout products, anything he takes that isn't prescribed. Dr. Vasquez walked to the patient's bedside. Mr. Reyes, can you hear me? The patient's eyes opened slightly. He nodded barely. I need you to think very carefully. In the past week, have you taken any vitamins, protein powders, energy drinks, or workout supplements? Anything at all? The patient's voice was weak. Just my pre-workout. Every morning before the gym. What brand? The patient mumbled a name. Vasquez pulled out her phone and searched. Her face went pale. She turned to Patel. Pull up the ingredient list. Patel's fingers moved quickly across the tablet. He stopped. His eyes widened. L-asparaginase, he read aloud. High concentration. Marketed as muscle recovery support. Oh my God. Dr. Okafor looked at David, then at the patient, then back at David. Cancel the OR, he said quietly. Start him on aggressive pancreatic enzyme support and fluid resuscitation. Treat this as drug-induced acute pancreatitis, and get toxicology to run a specific panel for asparaginase metabolites. Vasquez was already moving. Patel followed. Within 2 minutes, the treatment plan had shifted completely. David backed away slowly. He returned to his cart, picked up his mop, started cleaning the floor near the supply closet. His hands were still shaking. But this time, it wasn't fear. It was something else. Something he hadn't felt in 9 years. Not pride, not vindication. Just the quiet, steady sense that he'd done what he should have done. What he'd failed to do before. Dr. Okafor approached him a few minutes later. David kept mopping. You probably just saved that kid's life, Okafor said. David didn't look up. You would have figured it out eventually. Maybe, Okafor said. But not in time. He paused. Why didn't you say something sooner? Because I didn't think you'd listen, David said. Because I'm the janitor. And because the last time I spoke up in a medical context, someone got hurt. Okafor was quiet for a moment. What happened? David finally looked at him. I made a mistake. In research. A drug interaction I missed. Someone had a stroke. I resigned. And I've been cleaning floors ever since. I'm sorry, Okafor said. That must have been difficult. It was the right thing to do, David said. Leaving. I couldn't be trusted with that kind of responsibility anymore. Okafor shook his head. You just proved you can. 3 hours later, Jackson Reyes was stable. His enzyme levels were dropping. His blood pressure had normalized. The internal bleeding had stopped. Dr. Vasquez came out of his room and found David in the hallway. He's going to make it, she said. Full recovery expected. David nodded. That's good. She studied him. You didn't have to say anything. You could have just kept cleaning. I know, David said. But I did anyway. Why? Because 9 years ago I stayed silent when I should have spoken. And someone paid the price. I wasn't going to do that again. Vasquez was quiet. Then she held out her hand. Thank you. David shook it. You're welcome. She turned to leave, then paused. For what it's worth, she said, you were right to speak up. Both times. The first time, too. Mistakes happen. Good people report them. That's how we get better. David didn't respond. She walked away. And David went back to mopping. 2 weeks later, David was cleaning the ICU as usual when Dr. Okafor found him. We're doing a case review on the Reyes admission, he said. Departmental learning session. I'd like you to present. David stopped mopping. I'm not medical staff. You saved a patient's life with medical knowledge, Okafor said. That makes you relevant. I don't think that's appropriate, David said. The other doctors, they won't. They'll listen, Okafor interrupted, because I'm going to tell them what happened. And because they should know that expertise doesn't always come with a white coat. David looked at him for a long moment, then nodded. Okay. The presentation was scheduled for the following Thursday. David arrived early, stood in the back of the conference room. When his name was called, he walked to the front. 15 doctors and nurses looked at him, some with curiosity, some with skepticism. He told them about the case, about the supplement, about the interaction they'd almost missed. He didn't mention his background until someone asked, and when they did, he told them the truth. All of it. The research, the mistake, the resignation, the 9 years of cleaning floors. When he finished, the room was silent. Then a young resident raised her hand. Do you regret leaving research? David thought about it. No, he said. I made a mistake. Someone was hurt because of my work. Leaving was the right response. But I do regret staying silent for 9 years. I regret thinking that I didn't have anything valuable to offer anymore just because I wasn't in a lab. The resident nodded. Another doctor spoke up. Would you consider consulting, informally, on complex cases involving drug interactions or unusual presentations? We could use someone with your background. David blinked. I'm not credentialed. You're experienced, the doctor said, and you see things we miss. That's valuable. David looked at Dr. Okafor. Okafor smiled. We're not asking you to practice medicine. We're asking you to share what you know, when it's relevant. If you're willing. David was quiet. Then he nodded. I'm willing. 6 months later, David still worked the night shift, still mopped floors, still emptied bins and sanitized surfaces. But twice a month, he sat in on case conferences, reviewed charts when asked, offered observations when something didn't fit. The doctors listened, not because he had credentials, but because he'd earned their respect, and because he'd proven that knowledge doesn't disappear just because you're holding a mop instead of a microscope. One night he was cleaning the ICU when a new resident approached him. Nervous, hesitant. Excuse me, Mr. Cole? David looked up. Yes? I have a question. About a case. The labs don't make sense and I don't know who to ask. David set down his mop. Tell me what you're seeing, the resident explained. David listened, asked a few questions, then offered a possibility the resident hadn't considered. The resident's face lit up. That makes sense. Thank you. She started to walk away, then turned back. Can I ask you something? Of course. Why do you still work as a janitor? If you know all this, why not go back? David smiled faintly. Because I like this work. It's honest, it's simple, and it reminds me every day that no job is beneath dignity, that every person in this hospital matters, from the surgeon to the transporter to the person who mops the floors. We all see things, we all contribute. And sometimes the most important voice in the room is the one nobody expected to hear. Years later, when doctors at Presbyterian Memorial told the story of the janitor who saved a patient, they didn't tell it as a miracle. They told it as a reminder. That expertise lives in unexpected places. That mistakes don't define us, but how we respond to them does. That silence can be as dangerous as ignorance. And that sometimes, the person who sees what everyone else missed isn't the one with the most credentials. It's the one who was paying attention while everyone else assumed they didn't need to. David Cole never went back to research, never sought recognition, never asked for anything except the chance to keep doing his job. But he spoke up when it mattered. And in doing so, he proved that value isn't measured by titles or paychecks or degrees on a wall. It's measured by what you do when no one expects you to do anything at all, especially then. If this story reached you, share where you're watching from.